Oksana Pyzik. She is a lecturer at UCL School of Pharmacy, as well as a global health advisor. Oksana, good to have you on the show. The first thing that comes to mind is, how reliable are these rapid tests? Because we've read of many tests out there from various institutions, really pointing out that, yes, these tests can come out in 15, 20, 30 minutes, but they often give false negatives.
Yes, and a false negative is actually far more dangerous than a false positive, which is around 1 in 1,000 cases, current best estimate. Currently, false negative would be when there isn't enough of the virus detected via the throat or nasal swab. So again, if you're self-administering that, it's going to be potentially less accurate, and that's the current plan. So we do see when health workers administer these rapid lateral flow tests that they are cheap, they are quick, we get results back within 30 minutes. But the accuracy, the sensitivity tends to be a bit of a problem. So it's really important that the government communicate very clearly that any negative result could potentially be a false negative, but more importantly, this does not mean that you should stop wearing your mask or get too close to one another. So it's not a free pass. It can be helpful in picking up cases, asymptomatic cases. Sometimes we do see 1 in 3 people with COVID may have no symptoms at all. And when administered correctly, then these can be helpful in identifying cases that would otherwise be overlooked. But again, actually, these rapid lateral flow tests tend to be best used or more accurate when there's a very high viral load, when people are very infectious. So that's either right before or very early in presentation of symptoms. And the asymptomatic cases tend to not be associated with that. So I think there is actually some disagreement as to how helpful this will be. And the potential downside could be that someone gets a negative result, become very confident, particularly with our high vaccination rates, and then go on to potentially transmit the virus to others.
Oksana, tell me this. The second thing that comes to my mind is this is going to cost an awful lot amount of money. 2 weeks for every citizen every week. You are a global health advisor. Aren't there better ways in terms of spending valuable resources, especially during a time that we're seeing like now?
Certainly, it's going to be a big expense, and the government, in addition to this, in order for it to be more effective, I'd argue that we would have to spend even more, and that would be to ensure that currently people who do have symptoms, that may be self-employed, that don't receive benefits such as sick pay, are avoiding the current route of reporting to get a test or reporting symptoms. They're bypassing that whole thing. So it's very unlikely that then they will go ahead and get one of these rapid tests voluntarily, unless the government couples that with financially supporting those who isolate, as well as ensuring that it is coupled with contact tracing. Otherwise, it is a waste of funds. However, I'd argue if it does, it can be an effective tool, but you actually have to spend more to get the best out of it.
Some great analysis there. All right, Oksana Pyzik live for us from London. Thank you very much.